All right, welcome back. Hope you're all having a great week. Today we're continuing our RBT exam practice question series. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out rbtexamreview.com for a lot of our practice exams, our study guide, our combo pack, which comes with everything. It's our best deal. And of course, our competency study guide as well. When you do pass, let us know. We're working on a new format for shout outs, so those will be ready soon. Other than that, let's keep working hard. Keep studying hard. Questions, let me know. Love to help. And let's get into it. All right, question 1. All of the following answers are true about extinction procedures except for blank. If you are asked about a specific term or a specific procedure, before you dive into the answer choices, start thinking about everything you might know about that term. So let's go down the list of extinction. What do we know about extinction? We know extinction, you're withholding reinforcement for a previously reinforced behavior. We know extinction can lead to extinction burst, where behavior temporarily increases. We know extinction can cause spontaneous recovery, where that behavior sometimes comes back. We know extinction works to reduce the behavior. So we know these 4 things about extinction, which is going to help us, because what this question wants to know is which of these answers isn't true about extinction? Which of these answers doesn't fit into what we know about extinction? So A, extinction can reduce behavior. Can extinction reduce behavior? Absolutely. That's why we do extinction, right? When we put a behavior on extinction, we want to see that behavior happen less while other behaviors happen more. A is absolutely true about extinction. B, extinction can lead to a temporary increase in behavior. Sure can. What is that called? This temporary increase in behavior due to extinction. It's an extinction burst. Extinction burst is a temporary increase. Once we get to the peak extinction burst, then we can start to expect behavior to reduce once again. C, extinction is a punishment procedure. This always trips up people. Even BCBAs, this trips people up. We know extinction can reduce behavior, but extinction is not a punishment procedure. Extinction exists in its own bucket. If we're thinking about the 3 fundamentals of behavior change: reinforcement, punishment, extinction. Those 3 things exist independent of each other. We use them in conjunction with each other, but extinction is not punishment. Punishment is not extinction. It's very important to know and very important to remember. C is not true about extinction. Let's keep reading. Let's look at D. Behaviors put on extinction can sometimes reappear. Absolutely true. Behaviors previously put on extinction or that were extinct can sometimes recover. We call that spontaneous recovery. When that occurs, we need to continue putting them on extinction and they will once again reduce. But it is true that behaviors put on extinction can sometimes reappear. So the only one that isn't true about extinction is that extinction is a punishment procedure. C. Xavier receives services in an ABA clinic 5 times a week. When he gets to a clinic at 8 a.m., he is energetic and ready to play with his friends. When it is 9:30 a.m., his RBT will say, "Okay, time to work." Xavier will immediately say he is tired and wants to take a nap. The function of Xavier's behavior is most likely what? When the question asks about the function of behavior, what does the question want to know? The question wants to know, why is that behavior occurring? For what reason is Xavier saying he is tired and wants to take a nap? Now, clearly we're not doing a full assessment here, so we're going to have to hypothesize or give our best guess. First things first, what are our 4 functions? Tangible, attention, escape, and then automatic/sensory. They're the same thing. We know intangible, we're trying to obtain something, attain a stimuli. Attention, we're trying to obtain attention. Escape, we're trying to escape or avoid situation. And then automatic is when it's not socially mediated, when there's not another person involved. Automatic is the easiest one to identify or get rid of. If there's a person involved, delivering the consequence or involved in the behavior, another person, I should say, it can't be automatic. So in this case, you have Xavier and the RBT. It's socially mediated. We can eliminate automatic. So what else do we know? Well, we know that Xavier will say this right after the RBT says, "Okay, it's time to work." Is Xavier trying to gain a tangible here? No, right? He's not trying to gain anything here. Now, maybe you could argue he's trying to gain a nap, right? However, we know, right, at 8 a.m., he's energetic and ready to play with his friends only when the RBT says, "Okay, time to work." does Xavier immediately say he's tired? So that's the key, right? The antecedent to Xavier saying he's tired is, okay, time to work. So do we think he's doing it for attention? Well, no, Xavier's getting plenty of attention already, right? Only when the RBT says, okay, time to work, does Xavier try to say, no, I want to take a nap instead. Most likely, Xavier is trying to escape. And that's how we need to break down functions of behaviors, right? We need to understand the context, and then we need to understand what is the antecedent here. The antecedent is this, okay, time to work. It's not like we've removed an iPad from Xavier. It's not like we weren't giving Xavier attention or putting attention elsewhere, right? We're saying, let's work. Xavier's saying, I want to do something else. Xavier's trying to escape. After a great session, Margaret wrote the following session note. When I arrived, the client greeted me without prompt. We sat at the kitchen table and played a board game with his brother. The game went great. There were only 2 instances of the client crying, but that was due to the frustration over losing his turn. Afterwards, we did DTT and wrapped up session. What does not belong in these session notes? What do we know about session notes? We know they need to be objective, they need to be concise, and they need to be complete as possible. We want to know as much information as you can give while being objective. And when we say objective, we mean, what did you observe? Not what you felt, not what you think they felt, only what you observed. If we're evaluating these session notes, how are we going to determine what doesn't belong? Well, let's go sentence by sentence. First sentence, when I arrived, the client greeted me without prompt. Can we observe that? Sure. Can we measure that? Sure. Is this objective? Yes. There's no opinion. It's just, I showed up, the client greeted me, I didn't give a prompt. Perfect. We sat at the kitchen table and played a board game with his brother. Is anything wrong with this? No, we sat at the kitchen table and played a board game. It's objective, it's measurable. There's no opinion. We're not talking about how they felt or anything like that, right? It's just very objective, very observable. The game went great. Okay. Now that's adding an opinion, right? The game went great. Maybe for you it went great, but what about other people? How did it go, right? So that might set off an alarm bell. We're going to keep that in mind. There were only 2 instances of the client crying, but that was due to frustration over losing his turn. Okay, the first part's fine. 2 instances of a client crying, but due to frustration. Are we going to blame the crying on the frustration? No, because frustration is not observable. It's not measurable. So far, what are we keeping an eye on? We're keeping an eye on the game went great and this frustration word. Afterwards, we did the DTT and wrapped up session. Again, objective, no problems there. So really, only things wrong or what we might take out of these session notes are the game went great or due to frustration. So let's see. A, the client greeted me without prompt. That's fine. It's actually pretty good, right? Because it seems like this might be a skill they're working on. And if the client greeted without prompt, that might be a good thing. So A is okay. B, we played a board game with his brother. Again, totally fine. Not giving your opinion, just saying what happened. C, 2 instances of a client crying, but that was due to frustration over losing his turn. All right, that was one of our ones we picked out, right? We're blaming the crying on the frustration. Can we observe it? Can we measure it? No. What does frustration look like? Do we know they were frustrated, or is it your opinion they were frustrated? Something else might have been going on, right? The list goes on and on. We can't use frustration, okay, as a reason why the behavior occurred. And then D, afterwards, we did DTT. So after the game, we worked totally fine. Clearly, the worst part of the session note is going to be this idea that frustration led to the crying. We would not write that. C is our answer. You notice your daughter routinely texts and drives. You are worried she is going to get in an accident. You decide that when you ride with your daughter, you will give her $5 for every 5 minutes she doesn't text and drive. What type of intervention are you using? All right, we know it's a differential reinforcement question. What is our trick? What are our tricks to identifying what differential reinforcement procedure we're using? First things first, are we reinforcing for a behavior not occurring? Or are we trying to reinforce for a behavior occurring? In this case, daughter texts and drives. You say, okay, if you don't text and drive, I'll give you $5. Are we reinforcing for a behavior occurring or not occurring? Well, not occurring, right? We're not teaching a replacement here because why? Because we just want her to stop texting and driving. Once she stops texting and driving, we can maybe teach a replacement if needed. But our main priority here is to just prevent her from texting and driving. So if we're reinforcing in the absence of a behavior or for a behavior not occurring, is that a DRA, a DRO, DRI, or a DRH? DRH is not necessarily one you need to know as an RBT, as differential reinforcement of higher rates of behavior when we're trying to increase behavior. Don't worry about DRH. This is obviously not DRH. We don't want to increase how long or how often she's texting and driving. That leaves us with DRA, DRO, DRI. We just said we're reinforcing in the absence of behavior. So what DR is absence? Well, it's DRO, differential reinforcement of other behaviors. We're reinforcing other behaviors other than our target, which is texting and driving. DRA and DRI, we're teaching one, a replacement, and two, we're reinforcing for a behavior occurring. Okay, so very simple trick. Ask yourself, am I teaching a replacement? Am I reinforcing a behavior for not occurring? If I'm teaching a replacement, it's got to be DRA or DRI. If I'm reinforcing for a behavior not occurring, it has to be DRO. Only really worry about DRA, DRO, and DRI as an RBT. If you get those down, you'll be fine. For the first time ever, you notice a client emitting noises with their mouth. They are not forming words, but they're making letter sounds. If you wanted to use this behavior to your advantage, what would be the best thing to do? We want to use this new behavior to our advantage. So we want to take advantage of what? Of this client emitting noises with their mouth. They're making letter sounds, maybe like ah, ba, da, f, whatever it might be. How can we use that to our advantage, right? They're not forming words yet, but we can do something with these letter sounds. Can we shape it? 100%, right? Shaping is great for communication. If we want to shape ba, right, into bubbles, then when your client says ba, you might reinforce. If your client then says bub, you might reinforce. Then when your client says bubbles, you reinforce. We're shaping what? Approximations of the behavior. If you're ever in the situation where you're seeing pieces of a behavior happening, that's great. We can now start to shape those pieces. What about probing the behavior? Well, we can probe it, but it's not really using it to our advantage, right? Probing is just saying, can they do it? And we're watching them right now emit noises, so we know they can do it. What about putting the behavior on extinction? No, we want them to emit these noises, right? We're not going to withhold reinforcement for emitting noises. We're going to systematically deliver reinforcement through shaping, but we're not going to put on extinction. And then D, only reinforce if your client says a full word. Well, that's going to be the final step of shaping. But if they're only making a letter sound like ah, we're going to build up through shaping. So let's say they only say the letter A, right? And then, let's go back to ah, right? We want to teach apple, right? So ah, then app, then apple. That's shaping. We're going to get up to D, but if we want to use it to our advantage, we're going to use shaping as a whole. So what would be the best thing to do? A, shape the behavior. A client is known to elope or run from the clinic when the door is unlocked. An antecedent plan is developed to ensure the door is always locked. Another plan is developed with directions on how to respond if the client does elope from the clinic. This plan is considered a what? Eloping or eloping from the clinic. Do we consider that a dangerous behavior? Absolutely, right? High risk, dangerous behavior. Who's in danger? Well, the client's obviously in danger, leaving the clinic alone. Staff and BCBAs might be in danger for other reasons, right? But it's certainly cause, okay, for a special plan. And when we develop a plan that addresses emergency situations, well, what do we call that? Is it an antecedent plan? Well, it's not going to be an antecedent plan. Why? Well, it's reactive. The plan is reacting to the client eloping from the clinic. We've got an antecedent plan already in place, okay? This is not the antecedent plan we're talking about. What about a skill acquisition plan? Are we teaching a client any new skills here? No, our plan is strictly focused on what do we do if the client does elope. We're not teaching anything here, okay? We're only giving guidelines on how do we react if the client leaves the clinic. So what about a reinforcement schedule? Again, no, we're not trying to deliver reinforcement. We're not trying to determine when to deliver reinforcement. We want to determine what do we do if this client leaves. Therefore, we have a crisis emergency plan. If the client elopes from this clinic, that is certainly an emergency, right? The client's in danger, other people might be in danger. This plan, the entire idea of responding if the client does elope, is considered a D crisis emergency plan. A sign that says turn off the lights when leaving the classroom, an alarm that goes off when the refrigerator is left open, and a sticky note that says password is 1234 are all examples of what? What are all three of these things attempting to do? They're attempting to evoke a certain behavior. They're cues, they're stimuli, trying to evoke a certain behavior. The sign is trying to get you to turn off the lights. The alarm is trying to get you to close the fridge. And the sticky note is trying to get you to enter the correct password. Now, ideally, right, we would want you to just turn off the lights when leaving the classroom with no sign. We would ideally just want you to close the refrigerator without an alarm. And ideally, we would just want you to enter the password without the need of a sticky note. But sometimes we need a little help to gauge in the correct response, right? We want to use a cue to evoke the correct response. All that being said, what does that sound like? Are these motivating operations? Are they increasing the value of consequences? No, not necessarily, right? They're not increasing or decreasing values of consequences. They're evoking certain behaviors or cues to evoke certain behaviors, right? After SDs, but they're not motivating operations. Are they consequences? Well, no, they come before the responses. Are they probes? Are we probing anything? No, it seems like we already know how to do the behaviors of turning off the lights and closing the fridge and entering the password. We just need a little help. And if you already know a behavior, but need a little help to get that behavior to present itself, what are you doing? We're prompting, right? The sign is prompting you to turn off the lights. The alarm is prompting you to close the fridge. And the sticky note is prompting you to enter the correct password. All three of these are great examples of prompts. Why is it important that we try and identify several different reinforcers for our clients? Why would this matter? Why do we care if we have a bunch of reinforcers for the clients? Why can't I just take my client's favorite Barbie doll and use that every session? What's going to happen? Is the client going to be deprived of reinforcers? Well, no. If we have a reinforcer and I've got the Barbie doll, I'm not depriving them of reinforcers, right? They're going to have reinforcers, maybe only one though. So what could happen? Could they satiate on reinforcers? Absolutely. What is satiation? Satiation is getting too much or having too much, and then it loses its value. If I use the same reinforcer over and over again, the risk of satiation is much higher than if we start varying reinforcers, right? So why do we want to identify several different reinforcers? Well, in an attempt to avoid satiation. What about the client does not get bored? That is not behavior analytic, right? We would never pick C. And then D, it is unethical to only use one reinforcer. Not necessarily, right? I mean, there are some clients, we have a really difficult time finding multiple reinforcers. Sometimes you only want to use one reinforcer or a strong reinforcer if that's what's needed to change the behavior, but it isn't necessarily fundamentally unethical. The reason we really want to try different reinforcers is to avoid satiation. Brandon is running DTT with the client. Brandon says touch nose, and the client touches his nose. Brandon says touch foot, and the client touches his foot. Brandon delivers praise and a token. Based on this information, what reinforcement schedule is the client on? All right, basic reinforcement schedules. What are they? We have FR, a fixed ratio based on a fixed number of responses. We have FI, fixed interval based on a fixed amount of time. We have VR, variable ratio based on an average amount of responses, and then VI, variable interval based on an average amount of time. So first things first question you ask yourself for basic reinforcement schedules. Are we dealing with responses or are we dealing with time? Clearly, right? Brandon says touch nose, client touches nose. Brandon says touch foot, client touches foot. Clearly, we're dealing with responses. Well, if we look at our answer choices, unfortunately, we can't eliminate any answers. Now, if we look at continuous is also known as what? It's also known as FR1. And in an FR1, you're receiving reinforcement for every correct response. In this case, what happens? Well, the client has to engage in two responses for reinforcement, so it can't be continuous. It also can't be FR3, right? It has to be VR2 and FR2. Now, based on this information, all we know is Brandon the client engaged in two responses, and receive reinforcement. Based on this information, we think this is going to be an FR2. If we had more information, if we knew more about when Brandon delivered reinforcement, maybe our answer changes. But based on this information, it looks like a fixed ratio 2 because every 2 responses, the client's getting reinforced. All right, thanks for watching. Please like and subscribe. Questions, comments, let me know. Love to help. rbtexamreview.com for all of our study materials. Work hard, study hard. See you soon.